My name is Dr. Emily Boychuck. I worked in retail pharmacy as both a pharmacy technician and then a licensed pharmacist for several years, and now I work with the VA as a clinical pharmacist. I strongly encourage patients to have a good relationship with their pharmacist and don't be afraid to ask questions. Your pharmacist wants to make sure that you are healthy and safe. I'd like to review the process of how they do that and what you can expect when you bring your prescription to a community pharmacy. First, the pharmacist is going to review the prescription and make sure it is safe for the patient. They will check that the dosage prescribed and treatment makes sense. And they will review the information that they have available about the patient, such as allergies or interactions with other medications that the patient currently takes. The pharmacist may need to ask the patient a few questions to make sure that the prescription is safe. Some examples are the patient's weight, allergies, or pregnancy status. Depending on the medication, this information may be critical to the safety of the drug. The pharmacist might also contact the prescriber's office to clarify information on the prescription and may even discuss lab results or monitoring parameters to make sure it is safe and effective. Second, the pharmacy team is going to process the prescription through the patient's insurance plan. The patient can help make this process run smoothly by having their most current insurance card available, as the billing information often changes with each new year or new plan. Patients should talk to the pharmacy team if they have any special billing requests, such as billing a secondary insurance plan, a spouse's insurance plan, or a coupon card, to name a few examples. The insurance plan might request additional information before they approve coverage of the medication. One common example of this is a prior authorization request. In a prior authorization request, the prescriber needs to send the insurance plan information about why this medication is the best course of therapy. I encourage patients to communicate with both the pharmacist and the healthcare provider on the status of these insurance requests. If the insurance plan will not cover a prescribed medication, perhaps even after providing the requested information to the insurance plan, the pharmacist can help work with the prescriber to discuss alternative options that may be covered by the insurance plan. The pharmacist keeps the patient informed in the billing process, especially if there are any delays. And the pharmacist discusses with the patient if the prescriber recommended or changed the prescription to an alternative covered option. Third, the pharmacy team fills the prescription. The most common scenario is the pharmacy has the medication in stock and is able to fill the prescription that same day. Pharmacies try to stock their inventory in anticipation of what the community is most commonly prescribing. That being said, specialty products or brand name products may not be readily available, and the pharmacy team may need to order these specific to patient requests. If something needs to be ordered, ask the pharmacy team if they have information on the anticipated time frame. It may take a few days to ship or potentially longer if the medication is back ordered. The pharmacist can help patients with their options. They may be able to transfer the prescription to another pharmacy in the area that has the medication in stock, or they may be able to help coordinate with the prescriber if an alternative product may be appropriate in the case of an extended back order. If a patient knows they will be refilling a special order item, it is helpful to talk with the pharmacy team ahead of the next order so that they can plan to have it in stock. My number one tip for patients is to look at your medication before you leave the pharmacy. Open the bag and check if the medication looks the same as last time. Is this the prescription you were expecting? Pharmacies are often stocked with multiple generic manufacturers of the same drug. Therefore, the same medication may be dispensed, but it looks different, a different shape, size, or color. The generic medications are approved based on the equivalency to the brand name product. For seizure medications in particular, there are some drugs with narrow therapeutic ranges. Therefore, a change from one generic to another generic may result in a change of the therapeutic drug levels. If a patient notices their seizure medication looks different than last time, talk to the pharmacist about the change. Ask them if this is a medication with a narrow therapeutic range, and discuss if the previous generic is still available. Checking your pills before you leave the pharmacy will help make your trip run smoothly. There are federal regulations and state laws prohibiting a pharmacist from returning a medication once it has left the pharmacy. This is for patient safety. The pharmacist can no longer guarantee the drug has not been contaminated or tampered with after it leaves. Checking the pills before leaving will ensure all questions are addressed, and if any changes need to be made, they can make those changes. Having a good relationship with your pharmacist and good communication can help you navigate the insurance process and stay on track with refills. For any prescription questions, you can always ask your pharmacist. Thank you for listening to my presentation. And if you have any questions about the prescription process, please reach out to your
Okay, thank you. We have a couple more.
Hello everyone. Welcome to Epilepsy Awareness Day. I'm Dr. Grace Seema, a mental health critical pharmacy specialist at DRAVET Los Angeles. Hello everyone. Welcome to Epilepsy Awareness Day. I'm Dr. Grace Seema, a mental health critical pharmacy specialist at DRAVET Los Angeles Healthcare System. We'd like to share with you the relationship between mental health, epilepsy, and anti-seizure medications. Studies show that about 20 to 30% of people with epilepsy also have some type of mental health challenge, such as depression, anxiety, panic or fear, irritability or aggression, poor frustration tolerance, or behavioral disorders in children. People with epilepsy and coexisting mental health conditions present a more complex situation that requires a more complex assessment and treatment. These conditions can occur independent of the timing of the seizure, or they can happen 1 to 3 days before or 1 to 5 days after a seizure onset. Therefore, it is important to keep a record to share with your neurologist not only when the seizures occur, but also when any of these symptoms occur with respect to the seizure onset. This will help your physician tailor your medication regimen to best fit your needs and provide the best treatment for you. The timing of mental health symptoms with respect to seizures onset matters because the treatment will be different for each case. If the symptoms occur before the seizure onset, the treatment may require medications for psychiatric symptoms or psychotherapy. If the symptoms occur after the seizure onset, treatment will require the achievement of a seizure-free state. If the symptoms are caused by an anti-seizure medication, this will require a change in treatment. The main goal for epilepsy treatment should be to control and ideally get rid of seizures. At the same time, it is important to pay attention to how the seizure medications make you feel and how they affect your daily life. Sometimes a medication works well to control seizures, but it may affect your mood. For example, may cause depression. However, lamotrigine, valproic acid divalproex, or carbamazepine may elevate mood or have an antidepressant effect. On the other hand, levetiracetam, pregabalin, gabapentin, perampanel, brivaracetam, and cannabidiol may make you more irritable and anxious. You want to share how you feel with your doctor. You may change medications to find one that doesn't cause the side effects. It is very important that when a patient is evaluated for epilepsy, the neurologist has a comprehensive mental health history of that patient, including his or her family history. This is where the patient and family can contribute by providing a thorough psychiatric history and any new or ongoing symptoms to healthcare professionals. People with previous mental health history are at increased risk of developing psychiatric adverse effects when exposed to certain medications. In this case, the provider may choose an anti-seizure medication that does not worsen the mental health condition. People with pre-existing anxiety disorders have less tolerance to anti-seizure medications. The lack of tolerance to their anti-seizure treatment is mainly due to their pre-existing mental health conditions such as the anxiety disorder and not due to the anti-seizure medications themselves. Many people with epilepsy have coexisting mental health conditions like mood and anxiety disorders or psychosis. Therefore, in addition to their anti-seizure medications, they may also be receiving treatment with antidepressants, anxiolytics, or antipsychotics. The addition of these medications increases the risk of drug-drug interactions and drug-disease interactions. Such interactions are common and need to be monitored. Some anti-seizure medications can lower or raise the levels of other medications in your blood. For example, valproic acid or divalproex may increase the blood levels of a variety of drugs like lorazepam or antidepressants like paroxetine, amitriptyline, and nortriptyline. Another example, fluoxetine and fluoxamine may increase the blood level of phenytoin and valproic acid or divalproex, and possibly of clobazam, lacosamide, or primidone. An example of a drug-disease interaction is bupropion, an antidepressant, when given at doses above 600 mg daily, will increase the risk of seizures. If you have been taking the same combination of medications for a long time and are doing well, you probably don't need to be too concerned. However, if you're just starting one of the medications or are experiencing bothersome side effects, check with your doctor. It is imperative that you also notify your physician and your pharmacist before you start any over-the-counter medications, including dietary supplements or herbal remedies. This is important because some of them may decrease efficacy of your anti-seizure medications and increase your risk of seizures, even if you stick to your normal dose. For example, St. John's wort, an herbal medicine used to treat depression, can lower the levels of phenytoin and carbamazepine in the blood, which could result in potentially decreasing their effect in treating your seizures. The changes in serum levels can also exaggerate the effects of seizure medications, including unwanted harmful side effects. An example is CBD oil, a cannabinoid most commonly used for insomnia, anxiety, and chronic pain. Is also known to increase serum levels of topiramate, rufinamide, and zonisamide, which could lead to harmful side effects. Therefore, it is imperative that you always consult with your physician before you start any other medications or supplements, or if you experience any bothersome side effects. It is critical that you follow the medication regimen prescribed by your physician and do not stop your treatment without discussing with your provider. If you don't feel well or experience bothersome side effects, please notify your doctor immediately. Non-adherence to anti-seizure medications is associated with increased risk of mortality, hospitalizations, and higher risk of injury. I also need to mention that anti-seizure medications have a serious warning of possibly increasing the risk of depression, suicidal thoughts, or behaviors. Your physician will go over this with you in one of your initial visits. In conclusion, we recommend that you pay attention to any mental health symptoms that you may experience and keep a record of them. Also, notify your physicians and pharmacists of any change in prescription or over-the-counter medications. This will help them to optimize your treatment and minimize undesirable side effects.
Thank you. And then the last video, let me go ahead and share the last link for everyone.
Hello, everyone. My name is Jen, and I'm a clinical pharmacy specialist in neurology at the VA Greater Los Angeles Healthcare System. And today I want to talk to you about the do's and don'ts of anti-seizure medications. The main mode of treatment for epilepsy are medications called anti-seizure medications, or ASMs. Currently, there are over 25 ASMs available, and many people with epilepsy may take 2 or more ASMs to control their seizures. Taking your medications correctly and on time is very critical for successful treatment. Because there are so many different medications out there with many different properties, I want to go over some important do's and don'ts of ASMs. Here is a basic list of do's for your medications. First, know the possible side effects of your medications. Remember that some side effects may be mild, while others are more rare and serious. In the event that you experience a serious side effect, you're able to recognize it and seek medical attention if needed. For example, many ASMs can cause some mild drowsiness, and with time they go away. However, some ASMs can cause serious rash that needs immediate treatment. If you know what to expect, then you're better prepared. Secondly, it's very important to take your medications at the same time each day and to space them out as equally as possible. Try to set up a routine so that it's easier to remember. For example, if you take your medication twice a day, it may be helpful to take them right before you brush your teeth every morning and right after dinner each night. Try to keep it consistent with the routine and evenly spaced. Also, if your pharmacy allows for automatic refills, take advantage of this feature so that you never run out or are late on refills. If your pharmacy doesn't offer this, make sure to call in approximately 10 days before running out. It's a good idea to refill a little earlier than when you need it, just in case the doctor needs to renew the prescription, the pharmacy needs to order more medications, or if you refill by mail. Now, speaking of pharmacies, try to stay with the same pharmacy each time so that they have a complete record of all the medications that you're taking, and check to see if there are any interacting medications. It's also beneficial to know your pharmacist so that they can help with any medication-related questions you may have. Lastly, when you pick up your medications, check the appearance of the pills or capsules prior to leaving. You can check for the color, the shape, and the imprint. Sometimes pharmacies may change the manufacturer of your medication. So even though it's the same drug and the same strength, the medication may look different. In most cases, this won't make a difference.
cases, for some patients, it can lead to a different response. It's also good to check in case you receive the wrong medication altogether. Here is a list of don'ts for your medications. Don't stop taking your medications abruptly without contacting your doctor, as it may have serious consequences. If you have concerns about your medications, please talk to a healthcare professional so that they can address it appropriately. They will work with you to achieve the best outcome. Many ASMs need careful and gradual tapering of the dose to safely discontinue, so it's important that you get your doctor involved. Secondly, many supplements and over-the-counter medications can interact with your ASMs. Contact your doctor or pharmacist before starting any new medications, supplements, or over-the-counter drugs. Next, do not store your medications in the car or in the bathroom where the steam can interfere with the integrity of the medication. Doing this can decrease the quality of the medication and thus decrease the effectiveness of preventing seizures. It's better to store them in a cool, dry environment. Lastly, make sure to carefully check the expiration dates of the medications so that you don't take expired medications. Most medications that pharmacies dispense should have sufficient time to finish the bottle prior to the expiration date. But if you keep extra supply of your medication, if you have previous tablet strength left over, or if you have seizure rescue medications that are not regularly used, be mindful of the expiration date since expired medications can have decreased effectiveness. So we talked about the do's and don'ts of anti-seizure medications, but always remember that you don't have to do this alone. There is a team of pharmacists available and ready to help you. If you need help with your anti-seizure medications, please reach out to your doctor, nurses in your clinic, or even your neighborhood pharmacist. We pharmacists specialize in medication information and management. Some even have further training in epilepsy. You may find it especially beneficial to develop a close relationship with your neighborhood community pharmacist. They can give you important information about potential side effects of your medications. If you're taking multiple medications, either for seizures or for other conditions, sometimes the medications can interact with each other and cause changes in your treatment. Your pharmacist can help you manage those drug-to-drug interactions. If you ever see pharmacists during your clinic appointments, they can even provide you with further assistance, such as providing medication calendars and techniques to manage your side effects. Lastly, if you're ever thinking of starting an over-the-counter medication or supplement, you can consult your pharmacist to see if it will be safe. So thank you for tuning in to this video. And always remember the do's and don'ts of anti-seizure medications to get the most out of your treatment. And remember, you don't have to do this alone, as there are healthcare professionals ready to help you.